Part 2. Where is Mordechai? From physician, spouse and mom to a target. By Raquel K. Oh no, March 22, 2022. This is a work of fiction. Names, characters, places and incidents either are products of the author's imagination or are used fictitiously. Any resemblance to actual events or locales or persons, living or dead, is entirely coincidental. Before diving into my experience since leaving CAMU, allow me to provide you some context so that you can better understand my experience in the months leading up to giving Dr. Harman my letter of resignation. As you know, I was first brought on to work at the CAMU Vashti Women's Health Center in their fee-based clinic in Suite 1313, not realizing that there was an identical suite, 1777, only a few feet away, in the same floor of the same building. The only difference being was the Suite 1777 did not charge a facility fee. Both the Vashti WHC and its medical director are supported by a multi-million-dollar contribution from the Irene Vashti Foundation. Its current medical director is Dr. Julie Pritzker. An important fact to know is that prior to being transferred out of Suite 1313, I was one of Dr. Julie Pritzker's most productive physicians at the WHC. In fact, considering I was in the fee-based clinic, my productivity made up more than 50% of the total productivity of the entire Vashti WHC, meaning the fee and non-fee units. Logically, I thought my absence or any reduction of my time in her clinic would have a disproportionate impact on the Vashti WHC and that there would be no way she would cooperate with the move, let alone be happy with Dr. Harman's decision. Boy, was I wrong. To my surprise, when Dr. Harman made the official announcement, he made it a point that not only Dr. Julie Pritzker supported the move, but she also believed that it was the best possible move given the impact I would make in the non-fee general internal medicine clinic. In that email, which included the clinic managers and other administrators, Dr. Harman included a statement addressed to them, which didn't register with me at the time. He told them that they did not have to notify the health plan since I was still practicing in the same location. Soon enough, I began to understand what he meant and the implications of it. First, I learned that there was minor glitch to my transfer. I had to maintain a very minimal presence in the fee-based clinic at the Vashti WHC. In the beginning it was to be 2 half-a-days a week and then later 1 half-a-day a week. The initial reason given for the split location was that it was due to space constraints in the non-fee clinic. I was told there was not enough exam rooms. Things went along for a while and I worked in both clinics. Then one night a very strange event happened at the tail end of the day. I happened to strike up a conversation with a colleague of mine at the Vashti WHC. Yes, I understand. You must be thinking, how can a chat be a strange event, in and of itself? After all, this is CAMU, a world-renowned university, where colleagues routinely come together, share and exchange new ideas, and befriend each other. Quite the contrary, the culture was anything but open and warm. For me it was a cold and a very dark place, where colleagues were at best aloof and distant. Part of the problem is rooted in how physicians are compensated at CAMU Health and the fact that physicians are compensated based on their individual productivity. Each physician is essentially a competitor, competing for the same turf and the same patient base. Meaning if you help one, you are potentially taking food out of your own mouth. For this was especially true, given that part of my practice was in the fee-based clinic, and further limited to the fact that it only served women. Unfortunately, I soon found the atmosphere at the non-fee clinic not much different. In fact, it was even more competitive. The administration, rather than taking steps to encourage collaboration and friendship, further exacerbated the issue by intentionally pitting physicians against each other. For example, CAMU made available a monthly report, the Doctor Periodic Productivity Report, DPPR, that includes all physicians. Meaning you know who is doing well and who is doing poor down to the exact productivity unit. For some of you working in other industries, where compensation is based on productivity, I can hear you argue that perhaps this was Dr. Mann's attempt to foster healthy competition. On the contrary, this had just the opposite effect, and I think it was deliberate. The intention was more sinister. The intent was to deliberately cut off peer-to-peer conversation, build walls, and keep physicians in their individual silos, while fostering an atmosphere of distrust. Once in place, Dr. Harman and his cohort would be free to target individuals one by one, without risking that individual going to appear for help, other management, or even law enforcement. A person would just feel trapped, feeling nowhere to go, with the only option being to submit to the will of Dr. Harman. You see, Dr. Harman's circle of influence runs much wider and deeper than what you would think. Sure, his circle includes other physicians, healthcare professionals, and academics, but it doesn't stop there. Years ago, and honestly, I am not sure of the how and the when, Dr. Harman was approached by individuals from the Central Asian Republic, CAP. The CAP is a country that is run by a ruthless totalitarian dictatorship who views the interests of our country as a direct threat and are looking to undermine our constitutional democracy. During this time, Dr. Mann was approached by representatives of the CAP, who based on their research, profiling, and intelligence, was to become the perfect target for their overseas operation. They knew, as I later became aware of during an offhanded conversation I had with him, that Dr. Mann has deep-seated hatred against the country, specifically with what our government had done to his family. It appears that his parents and grandparents came to our country as hard-working immigrants, but due to no fault of their own, were eventually labeled disloyal and stripped of their possessions by the government, and even at some point unlawfully jailed. Therefore, not only being disgruntled, but also feeling financially disadvantaged compared to his former peers who left academia, Dr. Harman would find himself in the perfect position to help CAP. After all, as Senior Vice-Chancellor for Medical Services, Dr. Harman would have easy access to the latest biomedical research at CAMU. CAP's operatives also felt that with the right tools in hand, Dr. Mann could also access other fields of research, related to energy, defense, and general technology at CAMU, even some funded and supported by our own government. Nearly a decade earlier, Dr. Harman was equipped with an incredible technology gifted to him by CAP for specific operations at the university. It was a brand new, state-of-the-art spyware technology that was first developed in the Middle East, known as Project Unicorn. Unicorn would go on to give Dr. Harman tremendous power and influence. So much power, that Dr. Mann became intoxicated by the thought that he could control and manipulate anybody of his choosing. With this technology in hand, he had the very edge and leverage needed to extract sensitive and personal information and use that data to extort and pressure others into doing things they would abhor and detest. Dr. He-Man, feeling almost godlike, snapped and went rogue. With Unicorn in hand, Dr. Mann went beyond the mandate given by his CAP handlers. Soon he would branch off using the spyware for his own pet projects targeting those working with him, his staff, and even residents and medical students, mostly targeting young women. Dr. Mann would even use the spyware against the major contributors to CAMU Health, extracting financial support. He would become the grand puppeteer of CAMU, laying low but secretly orchestrating things with his magic wand behind the scenes. Again, for most of my time at CAMU, I felt cut off, alone, with my only solace being able to teach young medical students, who were still so curious, open, and engaging, and not yet tainted. But back to that offhanded conversation I had with a female colleague of mine at the Vashti WHC. We happened to be talking about the different opportunities out there as a physician. You see, I was one of those rare physician breeds at CAMU that came from the outside. By the time I had joined CAMU, I had been working post-residency for more than 15 years. You could say, to some degree, that I had seen and explored the world. The only exception being having not yet worked in primary care at a world-renowned academic institution, such as CAMU. I was speaking with Dr. Sherry Annapolis, a full clinical professor, who had completed her medical school education, residency training at CAMU, and her only work experience over the past decade had been at CAMU as well. In essence, her whole world was CAMU. Again, we were casually chatting about opportunities on the outside, when she suddenly went completely pale, and while staring off at a distance, said, "But where are you going to go?" At the time, I thought it was strange and wasn't sure of what to make of it, especially given her experience. Later I would come to know exactly what she meant. Once you are inside, there is no outside. Leaving CAMU in one piece, without paying up, is not an option. She felt trapped. Then about 2 months prior to giving my notice, I received an email inviting me to the annual career planning for physicians with my immediate supervisor, Dr. Harman. During these hour-long sessions, which tend to informal, we are supposed to indicate what we would like to do in the foreseeable future. This time, I took it rather seriously and put together a formal presentation. My presentation focused on the underserved Asian population living in the San Gabriel Valley and the fact that no major health organization servicing them, especially of the caliber of CAMU Health. I had indicated that I would like to become a medical director leading this charge on behalf of CAMU Health and the CAMU James Sheep School of Medicine. I sent it to Dr. Mann a couple of days ahead of our given Zoom session. During the session, things got very strange very quickly. First and foremost, once again, he did not have much to say. There was a lot of silence. Nor did he even bring up my presentation. The only thing he did do was open a page on his monitor showing the amount of $290,000. Dr. Mann then pointed at the amount, and then said that was the amount he would be paid by the medical school after he is recalled from his retirement. Then he capped it off by saying, "Esther, remember this number." That was basically the end of our discussion. I shut off the Zoom session feeling puzzled. What the hell was that all about kept bouncing back and forth in my head. From that moment on, I gave Dr. Harman a nickname. He was the Riddler. Whatever he wanted from me was never said direct, it was as though he and others at his direction used code to communicate. And I was supposed to know exactly what he wanted from me. It was during the last 6 months at CAMU that I started putting the pieces together. I started fearing not only for my professional reputation, but also for the physical safety of myself and my family. The two questions that kept coming to my mind: who is Dr. Harman, and who does he represent? Stay tuned. My story continues.